On Thursday, Kenya would record its first coronavirus-related death after a 66-year-old man who had been at the intensive care unit in a city hospital succumbed. A statement from the Ministry of Health indicated that the man, who was suffering from diabetes, had arrived in the country on the 13th of March from South Africa via Swaziland. The news came just a day after President Kenyatta announced that one patient had recovered from the virus. Thursday's development coming as Kenya confirmed 3 more COVID-19 cases, bringing the total of confirmed cases in the country to 31. Health Chief Administrative Secretary Mercy Mwangangi says over the last 24 hours, 74 samples had been tested at the various government laboratories.
Out of the 74 samples, we have received confirmation of 3 people who have tested positive for coronavirus disease. This brings the total number of confirmed COVID-19 cases in Kenya to 31.
The 31 confirmed cases are spread out across 5 counties of Nairobi, Mombasa, Kilifi, Kwale and Kajiado, with the government closely monitoring 906 close contacts.
All the 3 new confirmed cases are Kenyans, females aged between 30 years and 61 years. The 3 cases are close contacts of previously confirmed cases. 2 are from Kilifi and 1 from Nairobi.
Acting Director in the Ministry of Health, Dr. Patrick Amoth, announcing that the person who tested negative was case number 2 and was released after 2 consecutive tests turned negative. Amoth, however, not ruling out the possibility of reinfection.
And we follow the WHO-approved protocols which require that we do serial tests until we have 2 consecutive negative tests, and therefore the patient met that criteria after having 2 negative tests. Even if you are released from treatment or from quarantine, you are still required to follow the infection prevention control measures just like any other person.
Kakamega County had earlier announced a positive case in the county, raising protocol questions when it comes to relaying such information.
It's showing some signs of being positive, but his blood sample has been taken, and we are likely to have the results confirmed this evening. He has been confined, isolated from others.
The case that was reported by the government is actually a case that is currently admitted at Bagadia Isolation Center. But we want to appeal to the county governments that we have one central reporting system so that we are consistent throughout our reporting in line with WHO requirements.
The government reiterating the significance of the dusk to dawn curfew and strengthening the measures already in place. On Thursday, the government would, through a gazette notice, amend the list of those who will be exempted from curfew to include 7 other sectors: Kenya Revenue Authority, Kenya Airways, Kenya Airports Authority and licensed civil aviation service providers, Kenya Civil Aviation Authority, Kenya Ports Authority and licensed port operators, power production and distribution companies, water service providers, postal and courier services have been added to the list of essential service providers who will be exempted from the curfew. Others are medical professionals and health workers, national security, administration and coordination officers, public health and sanitation officers in the county government, licensed pharmacies and drug stores, licensed broadcasters and media houses, Kenya Power, food dealers, distributors, wholesalers and transporters of farm produce. Licensed supermarkets, mini-markets and hypermarkets, licensed distributors and retailers of petroleum and oil products and lubricants, licensed telecommunication operators and service providers, licensed banks, financial institutions and payment services have also been included in the list. Fire brigade and other emergency response services and licensed security firms will also not be affected by the curfew. Nancy Okware, Channel 1 News.